Hello, those just joining us. Just give us one more minute. We're expecting a good crowd tonight. We want to make sure everybody has time to get in. So just stick with us and we'll get started. Good evening, everyone. Thanks for joining our Men's Health webinar. We're excited to share this important men's health education with the group tonight. My name is Preston Brickner. I'm with Boston Scientific Urology, and I'll be your host and moderator for tonight's event. I'll start with a couple quick housekeeping items, and then I'll turn it over to our speaker. Most importantly, your participation tonight is completely anonymous to all the other attendees. No one will see your face nor your name. Any questions that you ask will only be seen by myself and Dr. Sharma. We encourage interactive presentations, so if you have a question, please type it in the chat box at the lower part of your screen. At the end of the presentation tonight, we'll save as much time as we can to answer as many of them as we can. At the bottom of your screen, there's looks like a little cartoon bubble. Just click on that and type it as we go. At the end, we will get to as many as we can. Tonight's webinar will be presented by Dr. Devang Sharma. Dr. Sharma is a comprehensive men's health specialist with fellowship training in male infertility, sexual dysfunction, and reconstructive surgery. In addition to general urology, his practice is focused on men with urinary complaints related to the bladder, prostate or urethra, erectile dysfunction, Peyronie's disease, low testosterone, fertility concerns, and prostate cancer survivorship. Dr. Sharma was born and raised in Montgomery County and graduated summa cum laude from the University of Maryland with a degree in bioengineering. He then graduated with honors from the Geisel School of Medicine at Dartmouth, then completed urology residency and andrology fellowships at the University of Virginia. Dr. Sharma, I know your time is in high demand. Thank you so much for your willingness to be with us this evening. I'll turn it over to you, sir.
Thanks, Preston. I appreciate it. And a big thanks for everybody who's logging in live. I think the attendance and the participation is really helpful during these educational seminars. For those that are not able to, we'll have a recording. And for those that are listening to the recording now, I think that's a great first step in learning more about all the different treatment options for ED. It's really hard to review everything in just one sitting. And, we do the best that we can, but it's always helpful to go back and get a little bit more information or get some refreshers on things that were covered. ED Cure is a really great resource for that. It's a quick, easy website. You can scan the QR code now if you have a personal device. If not, edcure.com is a great resource for educational material and also connecting with patient advocates who have kind of gone through the same thing that my patients may be going through now. So let's jump right into learning about erectile dysfunction and start off with a definition. So ED is defined as the persistent inability to achieve and maintain erection that's firm enough for sexual intercourse. ED is way more common than people give it credit for. Somewhere between 1 in 5 and 50% of men, depending on what age bracket we're talking about, are going to have some degree of erectile dysfunction. A lot of guys get a little bit concerned about, do I have ED? Do I not have ED? I think it's important to remember that it's a spectrum, right? So men on the milder end of the spectrum may be noticing some changes. They may think twice or have some limitations in terms of certain activities or in certain situations. And then on the other end of the spectrum, obviously, I take care of men who have been without a good sexual experience or intercourse for years and years. So it really is a spectrum, and where you land on that is a very personalized journey that we try to evaluate early on in the consultation process. It's helpful to get a good understanding of what normal male physiology is and how we get erections. It all starts with arousal. So that arousal can be visual, it can be tactile. It basically starts in involuntary communication between the brain and the penis, with signals passing through nerves that go through the brain, the spinal cord, and a complex of peripheral nerves that leave close to our tailbone. When that occurs, those nerves are sending signals for the blood vessels in the penis to change. The arteries that carry the blood flow from the heart to the penis start to dilate, and that dilation allows for improved blood flow into the penis. As the penis fills with blood, it gets longer, thicker, and harder. Once it achieves a certain level, then that expansion actually helps trap the blood inside the penis for the amount of time that we need to be able to use it for sexual activity. That complex is called the corporovenous complex, and that plays a really critical role in us getting that full level of rigidity and being able to maintain it for long enough for sexual activity. If any one of those components, whether it be the arousal, whether it be the nerves, whether it be the arteries that bring flow to the penis, or that corporovenous complex that traps the blood inside, if there's limitations to any one of those four or any combination of those four, that's what leads to ED. So there are a lot of different causes, and it is very, very rare that I see a patient who has ED caused by one specific thing. It's usually a combination of multiple factors. You can see from the pie chart here, the most common are vascular changes and diabetes, but there are certainly other things that can contribute as well. The most common risk factors that we see are age, smoking, diabetes, high blood pressure, cholesterol issues. All of those can impact the quality of blood flow and the vascular supply to the penis. There are other conditions that are associated. Depression can lead to issues with arousal. Certain medications that treat that condition can also be contributory. Obesity has multiple ways of contributing, whether it be hormonal or related to other associated causes like a sedentary lifestyle. Basically, if you're sitting on the couch, chances are your penis is as well. We should talk a little bit about the psychological effects, because a lot of the times when I hear men, they're reluctant to talk about ED because they're afraid that it's going to be minimized. It's not just a problem that occurs in the bedroom. For men that have ED and have gone through this experience, it can really be more than that. And I see men on a regular basis who have ED, but it affects them in so many different ways. It can cause depression. It can really cause anxiety, not only about sexual encounters, but just in general related to low self-esteem or low self-confidence. You know, so many of us kind of associate the feeling of being normal and what we're able to bring to relationships with sexual ability. And when that becomes compromised and is less than what it was and what we remember it, it can really make a big difference in how we see ourselves and how we present ourselves with intimate partners or even just people in general. Overall, that can cause a really significant decrease in quality of life, and that's really what I'm passionate about trying to restore in men. Let's talk about ED and certain conditions that go along with it. Since ED and diabetes are so intimately related, that's a good starting point. A lot of people don't realize that half of men with diabetes will not have a good response to common ED pills, right? So anybody who's gone through this should be familiar with the generic Viagra and Cialis, all of the brand name medications, all of the combination medications that are now marketed through these online men's health clinics like Ro, Lemonade, Hims, all of those things. Diabetics just don't tend to respond to pills in the way that everybody else does. And there's a number of different reasons for that, but it really has to do with changes that occur to both the nerves and the blood vessels. When a man has diabetes, really regardless of how well controlled it might be, blood sugars are higher than they should be. And that chronic level of elevated blood sugars compromises both the quality of blood flow to the penis, as well as those nerves that are critical from bringing the signals from the brain to the penis to let your body know that it's time for sexual activity. And when that occurs, you may be taking the pills and you may know upstairs that it's time for sexual activity, but the penis is never getting the message. And that's so common, it affects about 50% of diabetics. Now, obviously, there's other factors as well. So just having diabetes is not a death sentence for your penis. There are other things that are contributory. We talked about the effects that age can have on the quality of blood vessels. It also depends on how long you've been a diabetic, how poor the blood sugar control has been, and what other risk factors patients may have for underlying vascular problems. Again, the high blood pressures, the cholesterols, things like that. Heart disease can be contributory as well. We'll talk about that a little bit later in the talk. We'll talk about that right now. So ED can be an early indicator of heart disease. We talked about how important blood flow is to the process of getting good, healthy, normal erections. A lot of people don't realize that the blood flow to the penis is something that may become compromised well before blood flow to the heart or brain, meaning ED can actually be an early sign or an early indicator of future vascular disease that can affect organs like the heart or the brain, leading to things like heart attacks and strokes. This is a really helpful diagram that helps illustrate that. So when we talk about things like aging, blood pressure, diabetes, cholesterol affecting our plumbing, look at these different pipes, okay? These pipes will all equally be affected by these different disease processes that cause plaque buildup. Basically, the inside of these pipes get gummed up with cholesterol plaques that are not supposed to be there, inflammatory plaques that are not supposed to be there. And you can see that the penile artery, which is the pipe that allows blood to flow into the penis, is much smaller than the blood flow that goes to the heart, that goes to the brain, and that goes to the leg that you see here. When that process occurs, you can see how the blood flow is going to be reduced to the penis before any of these other organs. And that can be a risk factor. That can be a warning sign or smoke screen that something else is going on in the body. And whenever a man is coming in for erectile dysfunction, getting a good detailed history about what other risk factors exist for cardiovascular disease is an important part of that evaluation. The good news about vascular disease is a lot of these things are modifiable, right? We should all be very honest when we look at ourselves and our lifestyles and see where there's room for improvement, okay? The average American, me, and I would say the majority of my patients included, can all do a better job with diet, right? Even elite athletes work with dietitians and nutritionalists to fine tune and improve their diet, increasing fresh fruits and vegetables, increasing dietary fiber, having more whole foods and less processed foods is a really good place to start. We are probably not hitting our cardio goals the way that we should. The American Heart Association recommends 150 minutes of moderate intensity cardio per week. So what does that mean? That is very different than living an active lifestyle and hitting your 10,000 steps a day. Moderate intensity cardio is something that's going to get your heart pumping for at least 20 minutes at a time and enough so that you're not able to have a casual conversation doing it. And that 150 minutes per week is going to break down to about 30 minutes 5 times a week. I would say that most of us are not hitting that cardio goal. Losing weight can be very beneficial. Look at your weight, and I would say that most of us could probably stand to lose about 10% of our body weight. Obviously, talk to a doctor before you jump into actually setting any discrete goals for that. If you're smoking, you don't need to talk to a doctor about that. That's an easy, low-hanging fruit that should be addressed. Smoking is going to influence the quality of blood flow to the penis, and that should be something that should be a no-brainer. Alcohol use is a little bit more of a, touchy subject. Some people are not very open or straightforward about how much and how often they're drinking alcohol. Really when it comes to erectile function, there's no good amount of alcohol use, and reduction can make a big part in improving erectile function. Illicit drugs, whether that be something as casual as marijuana use to obviously to harder street drugs, that should be something that goes without being said, but those obviously can impact normal hormonal production and normal blood flow to the penis as well. A big thing for all of us is stress, right? I mean, whether you're working more than one job, whether you're a high stress professional, whatever your background is, I think most of us deal with a lot of stress, and working on stress reduction can make a big impact in alleviating some of the contributing factors to ED. Unfortunately, a lot of my patients are in between primary care doctors. Maybe they're established with a practice where they see multiple different providers, or they're really just not in the habit of going in for their routine wellness checks. This is a great opportunity if you're struggling with any ED symptoms. Just use that as a wake-up call to, again, reflect on these things that you can do on your own, but also renewing that relationship that you have with a good primary care provider to help get you on track for a lot of these things. We should talk about low testosterone as well. every man with erectile dysfunction should have at least a screening evaluation for low testosterone. And that means something as simple as an 8 a.m. fasting blood test to check where the testosterone levels are. When men have testosterone deficiency, which is a very specific diagnosis based off of 2 morning fasting blood tests and symptoms of low testosterone, that is a treatable condition. And by treating men who have testosterone deficiency, we can improve erections more naturally, but we can also improve how men respond to certain ED treatments. A lot of people don't realize, just like in diabetic patients who don't see the same response to pills as everybody else does, men with testosterone deficiency don't see the same response to pills that everybody else does. Testosterone is kind of like the best supporting actor. It's not the star of the show, the penis and the blood flow is, but without that normal testosterone level, it's going to lead to a less satisfying experience overall. Uh, Men with low T are, more likely to be older, obese, have diabetes. Sleep apnea is a big one. Okay, I can't tell you how many of my patients have had a sleep study before and kind of have sleep apnea, maybe were recommended to use a machine before and have found one reason or the other to kind of forget that diagnosis, not use their machine. It makes a huge impact on hormone production. So untreated sleep apnea or just sleep apnea with treatment even is the most common cause of testosterone deficiency that I see in my practice. It's an important thing and an important opportunity to, again, have that discussion with a primary care doctor about getting evaluated and getting optimized with a good sleep clinic. There are less common chronic medical conditions like chronic kidney disease and liver conditions that can affect testosterone levels. HIV and AIDS can also affect testosterone levels. Again, regardless of your underlying risk factors, if you're coming in with significant ED symptoms, it's important to have that fasting 8 a.m. testosterone level just to get a baseline of where you are and see if there's any room for improvement as part of a comprehensive ED program. Low testosterone can have a lot of symptoms that go beyond erections. We're not going to go into these in excruciating detail, but it can affect things like the drive or interest for sexual activity. It can impact energy levels in a pretty dramatic way. It can make it more difficult for diabetics to control their blood sugars. It can make it more difficult for men to maintain a healthy body composition, meaning less fat around the waistline and more muscle bulk. A lot of people describe a mental fog or issues with memory or concentration that can occur with lower testosterone levels. And then beyond symptoms, it can have health effects. Men with low T do tend to have lower sperm production, which can affect men who are hoping to grow their families from a fertility perspective. Men with chronically low testosterone levels can also develop what's called gynecomastia, which is the permanent development of breast tissue in men that can occur from signaling pathways that go out of balance when the testosterone levels are low. So, again, we won't go into too much detail about this, but testosterone deficiency is a treatable condition. It often goes hand in hand with erectile dysfunction, and it's an easy thing to check for, and it should be done for everybody who's walking in the door. There are a number of treatment options for testosterone. Again, we won't go into those in too much detail, but they come in the form of injections that can be really as simple and painless as doing an insulin injection, but it's once a week instead of several times a day. There used to be patches. Those are now discontinued. There are a number of oral medications that are still under brand, but available for commercial use. I'm not a huge fan of skin gels. That's commonly done by primary care doctors, just for ease of coverage, but insurance coverage is not always the best way to make decisions for your health. There's a nasal gel as well. And again, if you're coming in with testosterone issues, we would have a comprehensive discussion about that. This is a topic that is near and dear to my heart. I'm a specialist for our group who takes care of the lion's share of our prostate cancer survivors. Prostate cancer treatment is something that has come a long way, and we see tremendous levels of cancer-free rates. We prevent men from having metastatic disease burdens where cancer is spreading throughout the body and going to bones and lymph nodes and really limiting people's longevity. But after prostate cancer treatment, we also understand and realize that men don't have the same degree of sexual function that they did before they got treatment. And that goes for whether or not you had your prostate removed or whether or not you had radiation treatment for your prostate. They both ultimately have the same end effect. The path on how men get there is a little bit different. When men have their prostates removed for prostate cancer, most men are now familiar with what's called nerve-sparing prostatectomies. When we go over the anatomy for the prostate, you can see that the prostate is basically a Y connector. It sits at the base of the bladder and it connects both the bladder and the testicles to the back of the urethra and penis. That's what allows both urine and semen to come out of the penis and from the same plumbing. When the prostate develops a cancer and it needs to be removed, the entire section, including the seminal vesicles, which are the organs that provide the fluid that come out during ejaculation, are completely removed. The immediate effect of that is the loss of semen volume. But what a lot of people don't realize is that the nerves that, again, start from your brain and go all the way to the penis travel across the surface of the prostate. They can be peeled off and spared, so they are left behind after prostate surgery. But peeling those nerves off of the prostate can cause what's called a neuropraxia. Think of it as your leg falling asleep when you're sitting in an awkward position, but something that can last for months and months after surgery. There are a proportion of men that even after nerve-sparing surgery never truly recover the function of those nerves. So again, you may know that it's time for sex upstairs, but your boy downstairs is not getting the message. That occurs, again, regardless of if you've had nerve-sparing surgery or not. It occurs whether or not you had minimally invasive robotic surgery or more traditional open surgery. And again, this is also a process that occurs in men who have had radiation. It's not as dramatic as an effect as surgery is because the effects that occur with surgery are immediate. After the prostate is removed, those nerves immediately kind of go into hibernation. It can take anywhere between 12 and 18 months to see full recovery of those nerves. The path for men who receive radiation to their prostate, again, is similar in terms of sexual function at the end, but the way that men get there is different. After radiation, it's more of a slow burn. You may not see any initial side effects of radiation, but the longer it's been since that radiation treatment, we're talking about 2, 3, 5, 10 years down the line, the amount of semen does decrease, sometimes almost to nothing, and the quality of both blood flow and those nerves that, again, are caked on the surface of the prostate do become compromised as part of the treatment. There's a very large percentage, these studies vary. A lot of it is done within cancer research, which doesn't always do the best job at identifying men who have severe and persistent sexual dysfunction after they've had their prostate cancer successfully treated. More and more men are learning about Peyronie's disease. There's a lot of marketing and there's a lot of improved awareness campaigns for what Peyronie's disease is. We're still evolving our understanding of the disease process, but to keep it simple, Peyronie's is just a predisposition to developing abnormal scar tissue. I'm sure a lot of men have seen people who develop very kind of large, impressive scars on the skin, like keloid scars. Those are abnormal deposits of collagen that can occur from just regular scrapes and bruises in certain men. In the same way, Peyronie's disease is abnormal collagen or a fibrous plaque that can develop within the meat of the penis from routine sexual activity. It does not necessarily have to be associated with some type of fracture or trauma or event like a bend or a pop. Sometimes it is, but usually it occurs from routine activity in a certain subsection of men who have this predisposition. That plaque is different than the plaque that we talked about that can occur within blood vessels. It does not necessarily impede the flow of blood into the penis, but that part of the penis is less stretchy than the other parts are. So during a normal erection, when the penis is trying to get longer, thicker, and harder in a uniform way, it can't do that in that area of plaque. And you get this severe bend or hook around that inelastic tissue. Depending on where that tissue is in the penis, sometimes it doesn't necessarily cause a bend. Sometimes it causes other types of kind of anatomic deformities that we call dents or hourglasses, or in severe conditions, even hinges, where the penis can almost look like a bobblehead because of instability that's caused by these plaques. This can be a really challenging condition. This can be a very, very kind of severe condition for men that can be incredibly isolating. Men develop an avoidance pattern, not only because this plaque can cause pain in the penis during erections and with sexual activity, but because it's a dramatic change, right? I mean, men have a very special relationship with our penises. When it goes from something that you've been used to for years and years to something that looks completely different and foreign, it can have a huge psychological impact and barrier. It can affect erections as well, not necessarily in the ability of blood to flow into the penis, but in that complex network of the corporovenous anatomy that is supposed to trap blood into the penis. It's not always able to do that when you have this deposit of plaque there. This is part of a routine and comprehensive evaluation for ED, at least in my practice, where we're doing a physical exam at the start of a consultation to identify these plaques, or more often, doing what's called a penile Doppler study, where we bring men in for an evaluation that involves an injection in the penis that helps you get an erection in the office so that we can actually assess to see if there's any of those anatomical changes like curves, dents, or hourglasses, and actually assess with an ultrasound before and after an erection to see if we can identify these plaques. Identifying that can really help individualize the treatment that is recommended. Men who have these plaques are not good candidates for certain ED treatments like injection therapy for erectile dysfunction. So it's important to ask about this, and it's important to evaluate for this early in the disease process and early in the evaluation. There's a lot of different treatments for Peyronie's. Again, a lot of people get bounced around from different doctors that maybe don't have as much familiarity with the disease process or with the different treatment options available. It is a very treatable condition. There are non-surgical options that involve actually injections of medicine that go into and soften the plaque. That, in combination with a really comprehensive and rigorous physical therapy regimen, can help alleviate the curvatures that are associated with these plaques. There are surgeries that can be done either on the plaques or opposite to the side of the plaque to help restore a more functionally straight penis. And then penile implants are a really important tool in treating men who have both Peyronie's and ED. Implants will obviously go into in more detail later in this talk, but penile implants are inflatable devices that allow the penis to reconfigure to a more normal shape and anatomy, and it allows men to have the rigidity that they need for sexual activity whenever they need to. Again, we won't go into too much detail on the different types of Peyronie surgery, but I think it's important to know that when Peyronie's and ED go together, there's no replacement for an inflatable implant. And the benefits of that allow men to have treatment for both their ED and their Peyronie's in one highly effective procedure. We should go into all the different treatment options for ED. I think this is a helpful baseline. Part of what I do as a subspecialist is I try to individualize the treatment plans to the patient that's sitting in front of me. You know, a lot of men will have already seen or discussed their condition with a primary care doctor. You know, now with the real boom in this industry of men's health clinics, sometimes you've been evaluated by somebody who doesn't really have a whole lot of expertise, maybe just works in a setting that markets very heavily to men who have testosterone issues and ED issues. The level of detail that you get from those providers is a little bit different. You have to be a little bit mindful of those clinics that may have a financial conflict of interest in selling you things for cash, selling you compounded drugs, or charging based off of fees rather than through insurance. Just be mindful of that. I do partner with a lot of community primary care physicians, internists, and even cardiologists who do an excellent job on getting the conversation started and talking to patients about treatment options, it's fairly straightforward to have that conversation with your primary and start something like an ED medication. Oftentimes, either when that's ineffective or men are looking for a more comprehensive evaluation, they'll be referred to a urologist. You know, urologists are subspecialists. Okay, all of us are. We go through years and years of training that allow us to understand this disease process and how it's treated in a more complex way. Beyond that, a lot of men don't realize that there are subspecialties within urology. So some urologists are actually prosthetic urologists or ED specialists. I put myself into that category. I did a fellowship that was focused specifically on men's sexual health, and obviously it's a huge part of my practice now. So it's important to just have that conversation. It should start with the doctor who knows you best, which is usually your primary doctor. But it may be that you're already seeing a urologist and you've had these conversations before. And if that's the case, then again, it may be time to look and see if you can get connected with a men's health specialist, prosthetic urologist, or an ED specialist. We come by a lot of different names to just see if there's a little extra level of nuance or detail that can be done to help get you to the right treatment. This is a nice diagram that gives you a brief overview of the different ED treatment options, but this is not completely comprehensive. A lot of men will have heard radio commercials or seen kind of confusing ads about shockwave treatment. There is something called low intensity shockwave therapy for erectile dysfunction. It is an off-label treatment in the United States, meaning we use shockwave generators that are used by other specialists, by podiatrists, by rehab specialists that use basically ultrasound machines that generate low-intensity shockwaves that can be administered to the penis using very specific studied protocols. What that does is theoretically improves the quality of blood flow to the penis. It's a treatment option that is a nice adjunct for men who have mild to moderate ED, meaning people who are pretty early in their ED disease process and are maybe looking for alternatives to pills or are looking for a little bit of an extra boost beyond the treatment they're already getting. In my experience, men who do best with shockwave treatment are the ones who are kind of shopping the aisles of GNC, looking for a more natural treatment option for them. Um, it is not a one size fits all solution for people. It's an expensive option because, again, we use machines that are originally intended for other purposes, but have been studied and shown to be effective in very specific settings for ED. It's something that we can have a conversation with in person, but it's best done with a specialist that can really speak to what it is and what it isn't. I can tell you based off of radio commercials you've probably heard, it is not a time machine. It is not something that is going to bring you back to where you were originally, but it is a nice non-invasive adjunct that goes beyond some of the options that are listed here. We'll go into each of these four in detail as well. Men should have a really good understanding of how pills work, what they are and what they're not, about how a vacuum erection device works and how it needs to be paired with a good ring, which is that red band that you see at the base of the penis in the diagram here, how penile injections work, which I promise you hurt more to think about than they do to actually get done, and then obviously how implants work as well. Penile implants are considered the gold standard by ED subspecialists because they've been around for longer than any of these other treatments have, and they provide satisfaction rates and they provide efficacy levels that go well beyond any of the other treatments. Basically, to keep it simple, patients tend to be happiest with implants, and they work far better than any of these treatments do. We should start with lifestyle changes, right? Before even going into pills, shots, pumps, procedures, it's important to, again, reflect on some of these lifestyle things that impact the quality of blood flow, that impact your mental health, that impact your stress levels. We talked, I think, in good detail about things that you can do, reflecting on your diet, your cardio status, reducing toxins to your body like smoke and alcohol. But it's important to think about psychotherapy as well. And I don't love that term. I like coaching better. So I see this a lot in men. What happens is as soon as guys get it in their head that things are not working the way that they used to downstairs, it can become a self-fulfilling prophecy. Okay. In the bedroom, stress is not in your head. Stress is actually a chemical that is coming from the adrenal glands and surging through your bloodstream that will chemically make the penis softer. Okay. The analogy that I give men is when you're working out in the gym and you hit a plateau and you're no longer making gains. That's a good time to get a consultation or start partnering with a personal trainer, right? They're not going to lift the weights for you, but they're going to evaluate you. They're going to give you a regimen that's going to help break through that plateau so you can start making gains again. So, in the same way, there are an entire licensed group of providers called sex therapists that are basically like personal trainers for the bedroom. They're not going to hop into bed with you, but when you hit a plateau and you're not making gains in the bedrooms with different treatment options, it is helpful to have someone that acts almost like a coach to help you understand how you can kind of work through, work around some of these barriers, especially when it's starting to impact your self-confidence, when it's starting to impact your behavior, when it's starting to impact your relationships with your intimate partner. Let's jump right into medicines. So most people are familiar with how medications work. I think a lot of people don't get the explanation from their primary doctors or from their urologists about how a pill works in allowing you to achieve a more natural erection. Once you take the pill, it takes about an hour for that pill to make it from your mouth to your stomach to your gut to your bloodstream to your penis. Just like when you take a Tylenol or an Advil, it's not going to start working right away. After that hour, it is in your bloodstream for a very specific amount of time. When it gets there and how long it stays there is dependent on how much food you had on your stomach when you took that pill. So, for different pills on the market and different formulations of these pills, whether they be compounded, whether they be the routinely and very inexpensively FDA approved generics, it's very important to get the timing right. You should be taking a lot of these medications on an empty stomach. When a surgeon tells you to be on an empty stomach, we typically mean 8 hours of no eating. I don't know anybody who fasts 8 hours for sex. Okay. But that essentially makes a lot of these pills meant for morning sex. Okay. First thing in the morning, you essentially have been fasting for 8 hours, and that can often be when these medications are most effective. When you have that pill in your system and you get the timing right, this only works if all of the rest of that machinery is in place, meaning you have to have good arousal or good stimulation. You have to have good quality nerves from the brain to the penis. You have to have decent quality blood flow to allow it to fill with blood and get longer, thicker, and harder. And you have to have that mechanism in place to trap the blood inside the penis. If there is a significant deficiency of any of those four, then the pills are not going to work. What they do is they change your blood chemistry in a way that allows the blood flow to be a little bit stronger. Okay, so regardless of what the underlying cause is, it can make it a little bit easier to achieve and maintain that erection and ideally give an extra boost of rigidity. That may or may not be enough, but it is a fairly low risk thing to start with if you can get the timing right. And again, there are little tricks of the trade on how to do this. There are low dose daily medications that men will sometimes take almost like a vitamin to have an improved baseline amount of blood flow at all times. There are other medications that are more like a booster, where again, you have to plan ahead of time. That means both the meal and the timing relative to sexual activity, but it's a fairly low risk option that allows you to get an extra boost in terms of the quality of blood flow. There are very common side effects for these medications, most of which are not dangerous but are annoying. headaches, flushing, which means feeling red or hot in the face or chest, stuffy nose, kind of acid reflux or upset stomach symptoms, and even some leg or lower back cramping are the most common. All of those are annoying, but they are not dangerous. Okay. The danger that comes with these medications are with medication interactions. So if you happen to be on certain medications for an enlarged prostate or certain medications for heart conditions like angina, then these pills can interact with those medications and cause unsafe drops in blood pressure. So it's really important before experimenting or trying any of these pills to have a good understanding of how they can interact with other things that you may already be taking. It's also important to know that there are very, very rare but known associations with losses of hearing or vision associated with these medications. If you notice any changes to your vision or if you notice any ringing in your ears as a result of these medications, please take that seriously, stop the medication, and let your prescriber know about those side effects. Vacuum erection devices are actually a very old, tried and true treatment option for men. A lot of men don't realize that you can go and get a vacuum device without a prescription from a physician. There are a number of different models available. Now, the FDA does recommend a certain limit on the amount of strength that a vacuum device should be allowed to have on the penis. This is basically a chamber that you get a good tight seal around the penis, usually by shaving pubic hair and using a little bit of like gel to get a good seal. And then with a manual pump or a battery operated pump, basically drawing blood into the penis by having this chamber like suck on the outside, remove the air from the chamber, and cause the penis to mechanically expand, getting longer, thicker, and harder the way that it normally would with blood flow flowing through it more naturally. When it's done mechanically, the effect that you get is a little bit different. It's going to be a little bit more cold. It's going to be a little bit more numb relative to if blood was flowing in a more natural way. Also, much like inflating a balloon, you can get a balloon as big as you want. If you don't tie the knot, all of the air will come rushing out. So when you use a vacuum device, the first step is the seal, right? So whether it be shaving the pubic hair, pushing some of the extra fat or skin out of the way, or getting a good gel or lubricant to make sure that there's no air coming around the base of the device. If you have a good seal, you can really get the penis as big as you want. The vacuum device can probably get the penis bigger than any of the other treatment options can, but the vacuum device will do nothing to keep it that way. It is only as good as the ring that you're able to place at the base of the penis. And most of these vacuum devices come with rings that are just not small enough and not strong enough to maintain that erection. I always recommend that people get adjustable penile loops or penile rings. They're shaped kind of like bolo ties or lassos that go around the penis and have a small thing to cinch up the tie at the base. They can go over the vacuum chamber pretty easily. And then before the chamber is removed, you can cinch up that lasso to make the ring as tight as you need it to be. In order for these to actually be effective, it has to be a little tighter than you prefer it to be. There has to be a very small amount of kind of pressure or almost discomfort there to help keep that blood flow trapped inside. This can be an effective treatment option for men who have venous leak or that inability to trap the blood flow inside the penis. That ring goes a long way and it does not have to be complex. I've had a patient use a rubber band folded over 3 times and he had decent success with it. Again, the results that you get with this are not exactly natural. It's very common for men to have kind of more cold, numb erections when they use a vacuum device and when they use a ring. It's really, really important to not leave that ring on for too long. I can't tell you all of the different stories about going into the ER to try to pry things off of people who have passed out because of substance abuse with things on their penis, it's just not a good idea. I think the adjustable loops help keep you out of some of that trouble, but there is a little bit of nuance to how these work. It is reasonably safe to experiment with this and to try this again without a prescription from a doctor, but it's important to understand that getting that seal and then getting a really good, tight, kind of customized fit with that ring afterwards is the only way that this is going to be effective. You can see that, this is just not something that a lot of people stick with because it can be cumbersome. It's not exactly the most natural, and it leaves you with a lot of paraphernalia that makes travel a little bit more difficult. Injection therapy is an important treatment option to know about and is really where a lot of urologists will first get involved when patients are using ED pills and they're ineffective. This is one of the first treatment options that a urologist may talk to you about. The injections go into one of the two rods at the top part of the penis. The penis is made up of three rods. Two at the top get filled with blood for sexual activity. The one rod at the bottom is actually the tube or the urethra where the urine and semen pass through. It's really important to get good teaching and have good technique when you do these injections because you want to avoid that urethra that can cause a lot of pain. It can cause bleeding. It can actually cause unsafe scarring as well. The way these injections work is by completely bypassing the nerves that are supposed to be bringing the signal from the brain to the penis to have sexual activity. The medication that goes into the penis is the signal. It will almost involuntarily dilate the blood vessels to improve the quality of blood flow, making the penis longer, thicker, and harder. Now, as long as there's good hormones like testosterone to support a normal, healthy erection, as long as there's normal veins and corpora there to trap the blood flow into the penis, this can be a really effective option for diabetics who have nerve damage. And again, the signal is not making it down. This can be a great option for prostate cancer survivors who have had that kind of neuropraxia or nerve changes from their prostate cancer treatment, where blood flow is intact, everything was fine before their prostate was treated, but now all of a sudden the signals are not getting there. This bypasses that issue and allows the blood flow to be improved kind of within the first 5 minutes of getting one of these injections. The downside of this is sometimes that's too much. These medications are much, much more potent than the oral pills are, and they go directly into the body of the penis. So the one complication that men need to be familiar with is called priapism. That means you have an erection that does not go away. These injections can cause an erection that does not go away after orgasm. And while that might sound fun for an hour or so, beyond 4 hours, that's actually a medical emergency. That's something where you're not trying to sleep it off. You're not sitting there with an ice pack and trying to walk it off. You're going to an emergency room to get more injections of an antidote to get rid of that erection. If you don't, that blood flow that is supposed to be going in and out of the penis has been trapped there for long enough that you're essentially suffocating the penis. That can cause permanent damage to the normally spongy tissue that is part of those two rods at the top, and that can lead to a permanent loss of erectile function. That's a short-term risk just from one shot alone. The long-term risks of injection therapy are a little bit different. You can imagine using a needle repeatedly into these strong tubes can lead to scarring, much like the scarring that we saw in that slide for Peyronie's disease. The scarring that happens with injections is a little bit different. It usually doesn't happen in the lining of the tube, it happens within the meat of the tube, and it's called fibrosis. That can lead to a penis that is a little bit, we call woody. It's not as soft or as hard as it should be. It's stuck in this in-between state. And unfortunately, men who often use injections are diabetic. Diabetics are more prone to getting complications of injection use, like fibrosis in the penis. The other thing that is difficult about injection therapy is cost. The FDA approved medications tend to be really expensive, and they're usually not on formulary for commercial insurances or for Medicare. So we're left with trying to use mixes of medications that are even more potent, that allow you to use smaller volumes and allow them to be more cost effective. These often come from compounding pharmacies, which can be perfectly safe. But again, because these mixes are so potent, it's important to get your first injection in an office and make sure that the dose is appropriate and make sure that you know the exact amount to use at home. Overdosing on these medications can again land you in an emergency room in a very uncomfortable and even dangerous situation for the penis. So this is something that, again, is a routine part of many of our practices, but there's a certain degree of caution and nuance that you have to take with these injections that are really just not true for pills. The final treatment that we're going to talk about today is the penile implant, and I really don't want men to get the wrong impression when they hear kind of my passion and enthusiasm for this leaching through. This is not meant to be like a sales pitch for a used car or something like that, but you will hear me talk about this in a way that, again, is very compelling because I see men who benefit from this on a routine basis in my practice. A lot of men don't realize that the penile implant is one of the original ED treatments. Implants have been around longer than Viagra and Cialis. And when a man gets an implant, it allows them to have a reliable erection. Okay. It is something that is more foolproof than taking a pill or trying to get a good seal with a vacuum pump or hitting the right spot with a needle. An implant is a completely internal device that allows a man to have an erection that is as hard as he wants, for as long as he wants, whenever he wants. It is completely concealed. So much like the drawing that you see here, you wouldn't be able to tell that this man has an implant in unless you were using a CT scanner to actually see the components that are inside. This is a very sophisticated tool that allows you to have a really normal, soft penis that has completely normal sensation, normal urination, normal ejaculatory function. But when you want the ability to have that control, to have an erection that is as strong as you want, whenever you want, for as long as you want, meaning it will not go away with an orgasm. It will go away when you put it away. Much like other implants, this is a mechanical device and it is something that can wear down with use, but we're lucky. Penile implants are designed to last sometimes well beyond the life of a patient. This is very different than other implants from other specialties. One of my best friends is an orthopedic surgeon, and he routinely tells his patients to put off their knee replacements for a little bit longer because he knows that they're not going to last forever. I almost never tell a patient to put off a penile implant because it's not going to last forever. Now, it's a mechanical device, things can happen, but implants are designed to last well beyond other implants that are done, for example, by orthopedic surgeons. And because it's completely concealed within the body, it's not as obvious as a prosthetic arm or a prosthetic leg would be. I tell people that unless you're part of a nudist colony or an underwear model, nobody is going to know that you have this in your body. Let's go into a little bit more detail about what these things look like and how they work. Boston Scientific is unique in the fact that they have three very distinct penile implants that are available on the market and have been for a really long time. We're going to be spending most of our time talking about the AMS 700 with the MS pump, which is the tried and true. It is the most commonly used implant, and it's the one that's been around for longer than either of these other two models. Now, this is often called a three-piece inflatable device because there are three major components to how this works. Now, this is a diagram that, again, is using X-ray vision to show you all of the internal components of how an implant works. There is two cylinders that are placed inside your penis in a way that is totally custom fit to your anatomy. So we talked about how the penis is made up of those three rods. There are the two rods at the top that are supposed to fill with blood flow and allow the penis to get longer and thicker and harder. When there is an issue with the normal mechanisms that allow us to do that, this acts as a bypass. This is independent of blood flow. This is almost a hydraulic system that uses salt water or saline to allow these rods to fill with fluid that gets the penis thicker and harder in the way that a natural erection would work. This is all done by controlling the flow of fluid with a pump that is concealed inside the scrotum. So this is a small device, not too much larger than the pad of your thumb, that fits inside the sac in between the two testicles. You cannot see it from the outside. It fits very nicely between the two testicles. It allows you to control the transfer of fluid from this reservoir, which is basically a balloon that we hide behind the pubic bone or behind your six-pack muscle that holds this fluid when it's not being used. When you want to have an erection, you reach down and find this pump inside the sac. You squeeze it much in the way that you would squeeze like Nike pumps, if you remember those shoes that allow the cylinders to be inflated. After several pumps, you see that the fluid in the balloon gets transferred into those rods. It allows the penis to get thicker and harder in a way that a natural erection would. That rigidity is often actually stronger than a natural erection would be. We kind of joke with patients that you can hang a wet towel off of this when it's completely inflated. That erection is obviously strong enough to use for sexual activity, and it will stay that way even beyond a man's orgasm, which, again, almost in a jokingly way, we say is like a new superpower. None of us can do that normally, right? Unless you're a teenager. This allows you to restore a degree of functionality that some men have not had in years, some men had never had before. When the device is completely deflated, it returns the penis to a really natural configuration where it's not obvious that any of this stuff is inside the body. Let's take a look at how this works. So you'll see a video here. This is an animation. So again, we'll be looking at it with X-ray vision to see all of the internal components and how they work in action. From the outside, you see nothing. You put on your X-ray goggles and you can see all of the internal components. This man wants to have an erection, so he's reaching down in the sac and serially pumping this device that is transferring the fluid from that balloon that's hiding behind his pubic bone into the cylinders that are in the penis. Okay, he's now done and is pushing the deflate button that is allowing the fluid to very naturally return back to that balloon and return the penis to its more flaccid state. So now that you've seen the internal workings of that, I want to show you how it looks in action on a real person. So the next video that you see here is what I, again, jokingly call the HBO version. You'll see actual skin in this next video, and it will show you one of the many different pump techniques. So you'll see a man here without his clothes on. He does have an implant in place. You'll see the technique that he uses for pumping his device and getting a good, strong erection with the penile implant in place. This is a good time to put on your privacy filters or get your kids out of the room because, again, you'll be seeing a man from the waist down, totally undressed, pumping his implant. So you can see here, it's not at all obvious that this man has this three-piece inflatable device in. You can see he's manipulating his scrotum and he's finding that pump that's right in the middle. It's at the bottom part in between either testicle, so it's not getting squeezed. The testicles are not getting squeezed while he's manipulating this. He's basically holding the pump between the meat of his thumb and his fingers to pump this device. This is that erection that, again, can hold a wet towel because of how erect it is. Now, when he's ready to put it away, he's feeling the top part of the pump that has a very discrete deflate button. As he pushes that, you can see that the fluid is very naturally passing out of the penis and is allowing it to become soft again. If he's in a rush to get his pants on while he's holding that deflate button, or even shortly after, he can manipulate the shaft of the penis by either folding it or squeezing it to allow the penis to return to a more natural configuration. It's really as simple as that. Once the implant is put in, there's a series of kind of graduated exercises that allows a man to get to that level. It's not an instantaneous thing. Initially, when the implant is put in, there's obviously discomfort and sensitivity, right? I tell patients it may look like you got hit by a baseball bat between your legs for the first couple weeks. That's a very normal part of recovery. Once it's fully recovered, it's very seamless to be able to start manipulating this device. You start with baby steps, like just massaging the sac, usually in a hot shower, to get a sense of where all of the components are. There's a part of the pump that allows the penis to become rigid, and then there's a part of the pump that is just a very discrete button that allows the penis to get soft again. For the first couple of weeks, all my patients are doing after surgery is massaging to get oriented to where this hardware is in their body. Because again, you can't see it from the outside, but you can feel it with the tips of your fingers. After those first couple weeks, my patients are allowed to start pumping. Early pumping and early cycling is how you kind of get back on your feet and get back to sexual activity as quickly as possible. During those first couple weeks, it may be more difficult to inflate the cylinders because we're not removing any tissue from the inside of the penis. We are custom fitting, tailor fitting these cylinders to within 5 millimeters of your natural anatomy to be able to create an erection that is as close to your normal erection as possible. Because we're not removing anything, these cylinders are just going in internally. When you pump it up, you'll feel that pressure of these rods kind of expanding the natural penile tissue the way that it normally would if it were filling with blood. You may have discomfort initially in that process, but with practice, then all of that discomfort goes away. And much like the man who was pumping the device here, it is totally painless and it's totally under your control. Unlike pills, unlike the vacuum pump, unlike the injections, this gives you a reliable erection, regardless of if you're on an empty stomach, regardless of if you're shaving your pubic hair and getting a good tight ring on, regardless of if you're using inspired injectables or hitting the right spot. This is something that just becomes part of your body and gives you reliable results that you can have whenever you want without anybody else knowing that it's there, and something that will outlast a lot of the other implants that we do within other specialties. Now, after surgery, people always kind of worry, what is the recovery like? For anyone who's had a hernia surgery before, this is probably most similar to that. Although in my hands, a lot of patients are getting a minimally invasive approach with only one incision on the top side of the penis that allows for a much quicker recovery with less bruising and less swelling. There's a wrap that's placed around the penis and genitals, almost as if the penis is in a walking boot for the first couple of days after the procedure. Again, helping minimize the bruising and swelling, allowing you to start manipulating your pump faster after the procedure. Oftentimes, there's a surgical drain in place to help remove any of the residual irrigation fluid and things that we use at the time of the procedure to help. Oftentimes, I leave a Foley catheter just for one night so that patients are not worrying about soiling their dressing during urination. That's removed the next morning without any issues. This is an outpatient surgery. A lot of people don't realize that this is a 90-minute procedure that we do in our outpatient centers. People go home the same day. I prescribe a very limited amount of strong pain pills afterwards. Most of my patients don't end up using them. You typically are on alternating over-the-counter pain medications for the first 5 days after the procedure. You may take a stronger pain medication the first night or two because you're nervous about the discomfort associated with this, but done, in a very thoughtful and methodical way, this can be a fairly quick, seamless recovery for, as crazy as it sounds, all of those components going in through these minimally invasive openings in the skin, placed in a way that allow for a much quicker recovery. Uh, the surgical recovery really is on the magnitude of about 2 to 4 weeks, bruising, swelling, pain. Functional recovery is different. Okay, again, my buddy is an orthopedic surgeon. I tell him all the time that he's spoiled. Once he puts in a new knee or a new hip, all he's got to do is send his patients to a physical therapist and they take it from there. There's no physical therapist that can teach you to use your penis again after a penile implant, right? It's just you and me. So everything that I do is to help set my patients up for a more seamless recovery. I try to empower my patients to do as much research and as much learning about the device and the functionality before their procedure. So they're familiar with the pump, they're familiar with the mechanics, they're familiar with all of the different techniques. You only saw one of the pumping techniques in the video today. There's other great high quality videos that I share with my patients so you can learn all of the different ways to manipulate this pump in a way that it's most comfortable for you and most appropriate for your anatomy. That allows people to return to sexual activity sometimes as quickly as 4 to 6 weeks after these procedures. Now, obviously, that's a spectrum, right? On one end of the spectrum, I've had patients sitting there tapping their foot, just waiting for me to give them clearance to actually start using their device for sexual activity. And then there's the other end of the spectrum where, sometimes rehabbing the device may be a little bit more difficult than people realize. I've done these procedures for patients well into their 70s and 80s on a very routine basis. Sometimes we underestimate the grip strength that is necessary to manipulate these things. With age, we lose some of the dexterity, some of the sensitivity that we have in the tips of the fingers. Sometimes you develop arthritis that limits grip strength. These are all things that are evaluated during a consultation for an implant. I often tell people to squeeze my thumb and almost break it off to see how strong is that grip strength. Is it equal for both hands? Now, men almost always do better when they engage their partners in the process. So oftentimes during these implant consultations, I encourage men to bring their partners. Watch this video, right? If you're watching it alone, go back to the recording and watch it with your partner. Because again, this is not just for you, this is for both of you. And for me, the benefit of that is we have 4 thumbs to work with. So oftentimes I'm teaching partners to learn and control the device as well. That can be part of foreplay, and that can lead to a much more satisfying experience for men. So a lot of people have questions about cost. Remember, I told you this is one of the original ED treatments. So it is a covered procedure for Medicare. This is not, you know, an elective thing like a nose job. This is not cosmetic surgery like plastic surgery is. This is restoring function to an organ that is designed to do more than just peeing, right? You should not ever write off ED as a normal part of aging. I have plenty of men in their 80s who have robust and vibrant sex lives. Age is just a number, right? Age can impact things like quality of blood flow, sensation, and other things, but it doesn't mean an end to your sex life. What Medicare does by covering these things is tremendous, right? Sometimes this is a 65th birthday present for patients who have a private payer that arbitrarily decides that they're going to withhold coverage for a warranted procedure like this. Medicare really doesn't have to throw you those loops that you have to run through to get coverage sometimes. Private payers will cover as well, but that really varies, right? I mean, you don't know sometimes until the nth hour what the degree of coverage is going to be from a private insurance company. And oftentimes there are things that need to be fulfilled beforehand. A private insurance company is not going to pay for an implant unless you've tried cheaper options first. Part of the evaluation is sometimes proving to an insurance company that this is a medically necessary procedure for men who are suffering from a medical condition. Again, this is restorative surgery. This is not something elective like a nose job. Surgery is surgery. So people need to understand for implant surgery in particular, the satisfaction rates are really high, but my job is not necessarily to get people to sign up for these procedures. It's actually to understand all of the things that can happen during surgery and help people understand what the ins and outs of this procedure are, what it is and what it isn't, so that men are making the right choice for them. I can talk all day long about this stuff, but it's very different to hear it from someone who's actually gone through it before. And one of the things that I love best about partnering with Boston Scientific is the program that they have surrounding patient champions. You'll be able to hear from patients who have gone through this before, and they do such a good job of matching patients to champions that you can find somebody who has the same age, has the same hobbies, has the same interests as you. This is the slide that I was trying to get to. It's such a robust network of patient champions that you can connect with somebody that can really talk to you about what they went through and what their journey was like. I have some of my own patients who have volunteered to be champions, and they'll tell you like it is. I do not handpick these people. These people are volunteers that will, tell you all of the lumps and bumps along the way during their recovery, whether it be pain, whether it be fiddling with their pumps and figuring out how things work, whether it be navigating, the new workflow of having an implant in and being able to pump it up whenever they want. It's just an invaluable experience to be able to talk to someone who's been through it before. I want to go back. There's good information here about risks of these procedures as well, and that's critically important. When we talk about risks, it's it's always a process. We can never explain all of the risks and details in one webinar. Okay, that's not the purpose of this. The purpose of this is really to allow people to understand that there's such a breadth of different treatment options. And my goal as a subspecialist is to try to get a better understanding of what are the individual contributing factors for each of my patients' conditions, and then help tailor fit the treatment options to where people are and what their goals are, right? Not everybody needs a penile implant. Not everybody is going to do best with a penile implant, but not enough people know what a penile implant can do and how it can be so restorative to people's quality of life. There are obviously risks that go with that. Okay, we do this at an extremely high level. Everybody in the operating room is specially trained to be able to do these procedures. And that's not just me. This is not a one-man show. I work with a really sophisticated team that does this on a regular basis. If you look at US World and News rankings, our outpatient surgery centers are nationally ranked, and the type of procedures that we do like this are a big reason why patients are incredibly satisfied and they get through these procedures in a way that is really safe. You have to understand that surgery is surgery and things happen. When you partner with a surgeon, our responsibility is to be able to get you through it regardless of what happens along the way, right? This is a marriage between a surgeon using his experience and judgment to get through men who have different anatomies, different pathology. The longer you've had ED, the more difficult it is to do these procedures sometimes. The more factors that complicate things like prior surgeries, prior radiation, diabetes, prior injection use, Peyronie's disease, all of these things can complicate the placement of an implant. The main things that men need to understand is that overall, this is a fairly low risk procedure that, again, is done at a very high level on a mostly outpatient basis. The main things that men need to understand is that this is a device, and much like other devices, it can mechanically fail. Now, this is not filled with battery acid. So when an implant fails, it just means that it doesn't work anymore. It doesn't necessarily mean that something bad is going to happen. Remember, this is just filled with salt water. So when people have a mechanical failure, all that occurs is that they're pumping the device and it's not getting inflated anymore. It's very easy to identify. It's not very easy to fix in the office. Obviously, that requires a repeat procedure to remove the components that are not working and replace it with ones that are. It's a very uncommon situation. There are studies that are done for implant patients, following them out for years and years, asking them about their device functionality. The vast majority of implant patients have their device for well over 5 to 10 years, never requiring any maintenance, never requiring any additional procedures to adjust it. When it's in and it's working until it's not. That's one of the best parts about it. Infections can occur. Infections are very uncommon, particularly in men who have never had an implant before. If if you're a virgin implant and you've never had one before, the risk of an implant infection is typically less than 3%. When an infection happens that involves the implant, not just the skin that the implant went through, but the implant itself, it can be very difficult to treat. Usually we treat infections with antibiotics, but when hardware becomes infected, bacteria can develop a biofilm that actually lives on the surface of that device and can only be appropriately treated with complete removal of the implant. That is the primary thing that implant surgeons concern themselves with. That is the main thing that keeps us up at night, is making sure that we are identifying patients who will do well with this procedure. Again, the vast, vast majority do, but when you do this surgery on a regular basis, this is something that you think about all the time. One of the reasons why I really partner with Boston Scientific on this is because of the inhibisone coating. They have products that come from the factory pre-coated with antibiotics that are impregnated into the surface of the implant. What that allows us to do is have a device that's in place that is continuously dissolving low levels of antibiotic around the implant for several days after it's implanted. That helps prevent a lot of those pathogenic bacteria, the ones that are going to get you sick, from setting up shop on the surface of that implant. When we sign people up for surgery, there's a lot that goes into stratifying what somebody's underlying risk is. And a lot of what we're doing is tailoring the types of antibiotics, the duration of antibiotics, and the selection of antibiotics based off of people's underlying risk. One of the nice things about these implants is that when they come pre-coated, it just removes one of those elements out of the equation. It ensures that everybody's getting some baseline level of coverage that really can't be removed from the surface of the implant. It's baked right in. So I can talk all night long about stuff like this. I'm going to stop myself just looking at the time right now, but I want to give people an opportunity to ask questions because I know that we've had tremendous attendance here during this live webinar. I'm going to turn it over to Preston, who's going to go ahead and start reviewing some of these questions. We have about another 10 minutes or so to review these. For those that did not get their questions answered, we're going to go ahead and keep a list of this and try to address it at the next educational seminar that we have. So